In my playbook tonight, President Obama says it's now or never for health care reform. Whoa. The president warned yesterday that if Congress doesn't deliver health care legislation this year, the opportunity will be gone. We have a guy in the White House who wants to do something about health care, no doubt about that. Then you have the right-wing sound machine mounting the charge to block reform. This Sunday, a group called Conservatives for Patients' Rights. They are going to be airing a 30-minute infomercial. The mission? To scare the hell out of the American public. The man behind the campaign is Rick Scott. Scott is the controversial former CEO of the hospital chain HCA. His campaign against health care reform, of course, is being coordinated by the same PR firm and that group that, did the swift boat attacks against John Kerry back in 2004. So those are the players. Think Progress has put together a video looking at Rick Scott's career and what type of health care system he would actually advocate. Let's watch.
A once powerful healthcare executive who opposed healthcare reform and built the Columbia healthcare empire during the 1990s and was forced to resign in disgrace. One tactic Scott's company employed, for example, was to buy out all of the hospitals in one community and shut them all down but one. Doctors complained about cheap medical equipment. Nursing staffs were downsized. Scott's companies made billions, in part by systematically defrauding the government. Will we let Rick Scott impose his profits at all costs vision of healthcare on America once again? The choice is up to you.
Joining us now, John Podesta, who's president of the Center for American Progress. John, good to have you with us tonight. Thanks for telling the truth on that one. I've been talking about this guy on the radio for a while. I want to ask you, John, because you have been through these wars of getting an agenda through. What does President Obama mean when he says now or never, meaning 2009 is such a crucial year? What's your take on that?
Well, look, he has put health care reform front and center in his agenda. It's the most important item, and not only, I think, to get people the health care they need at a time of economic crisis, but really to kind of reform the way the whole economy works so that businesses can thrive, families can thrive, and the government can continue to, in the programs that it produces, particularly Medicare and Medicaid, it can have a system that's going to provide quality, affordable coverage for every American.
But politically,
the time is now. We got to do this summer.
Well, okay, this summer, because when we get into the midterm, 2010, the political climate could be a little bit different. I mean, that's what I take when I hear the president say now or never.
Yeah, well, absolutely. And I think that the Congress is set to do this. There have been, major progress moving forward in the Senate as well as the House. I think the Congress is primed to make the tough decisions to get costs under control in the healthcare system to provide affordable coverage for every American. But we're coming up to the tough decision time, and that's why these right-wingers are out there in force. And Rick Scott is really, I guess, the worst spokesperson. His company's paid $1.7 billion in criminal and civil fraud. He had been forced to resign by his board just before that, but they had been bilking Medicare overpayments. They had, as the video notes that we produced, providing lousy coverage. They put profits above people in the systems they built. So to put this guy out in front with a $20 million ad campaign to scare people into thinking that we can't do better is really, it's sort of shocking, but that is what they do.
What should the Obama administration do to counterpunch this 30-minute infomercial that normally things like this have an effect on people? What should the play be right now?
Well, look, I think, you noted the swift boats. I think the biggest lesson that should have been learned from swift boats is that you got to tack back. You got to put the real facts on the table. The president's put ideas on the table that the Congress is considering that will let you keep the coverage that you have, pick the doctor that you want if that's what you prefer, but it'll also give you choices to provide, to take on health insurance that will become affordable and give you better choices in the future. So, it's going to be a fight to, as I said, to get costs under control in the healthcare system, to give people choice, to provide people at the low end of the income spectrum the support that they need, and And Congress, I think, is ready to do that.
I hope so, and I hope they don't forget a public option. Quick take on that, John. We got to run, but do you think that a public option will be part of the Obama plan?
Well, it definitely is part of the Obama plan, and I think it will be part of the congressional plan as well.
All right. John Podesta, Center for American Progress, thanks so much for joining us tonight.